Swayam Prabha. Digital India. Educated India.
Hello dear students, I am Dr. Mona Semalti from HNB Garhwal University, Srinagar, Garhwal. I welcome all of you in this module, and today in this module I am going to discuss about ear drop and eye drop for pharmaceutics 1. So I hope you all have enjoyed my previous videos. So let's see quickly the learning outcome of this module. After going through from this module, you will be able to know about ear drops, eye drop, and what all ingredients we need for the formulation of ear drop and eye drop, and the procedure for the formulation and the instructions required for use of eye drops and ear drops. So let me introduce you to eye drop and ear drop. See, ear drop is a pharmaceutical preparation. It is in the form of solution that is meant to be instilled into the ear. And eye drop is an ophthalmic product or sterile product and meant for instillation in the eye in the space between eyeball and eyelid. Okay, so these preparations are sterile preparation. Very important to know that these preparations are sterile as they are instilled into the circulation, okay, systemic circulation and in the body cavity. So somehow these preparations are in direct contact with our systemic circulation. So sterility is must for these preparations. So they must be sterile. Now let us take ear drop in detail. Okay, ear drop stands for solution, as I told you that it is administered into the ear, and the solution is prepared in water, glycerin, propylene glycol or alcohol. So these are the bases for preparation of ear drop. Now, the vehicles like glycerin and propylene glycol, they are well preferred as they increase the contact time and soften the wax. And why they increase the contact time? Because they have got the more viscosity as compared to the water. Okay, so ear preparations are usually placed in the ear canal, and the drops we drop a small amount for the removal of excessive cerumen also. Okay, cerumen also, cerumen which is a ear wax. Okay, so this is about ear drop. Now before moving in detail about the formulation of ear drop, let me tell you that ear has mainly three sections. Okay, outer ear, middle ear and inner ear. So the outer ear, it contains the external part of the ear as well as the part of the ear canal that leads up to the tympanic membrane. And cerumen, which is a ear wax, is produced in the skin of the ear canal. So it serves to lubricate the canal and trap the dust and foreign materials. Now the middle ear, it contains three bones. Okay, three bone ossicles: the malleus, incus and steps. So these are three bones which are there in the middle ear, and it also contains Eustachian tube. Okay, Eustachian tube, what is the function? The function of Eustachian tube is to equalize the pressure and it allows the mucus drainage. And inner ear it contains the cochlea, which is the organ for hearing. The inner ear, it also contains three semicircular canals and the vestibules, which functions mainly its function is to produce the balance, all right, from the outer environment. So as you can see in this figure, so just look at the figure showing you the structure of the middle ear and inner ear. Now moving to the ingredients which are used for ear preparation. Now ingredients, what all raw material we need to formulate a ear drop. Antibiotics, or generally we need vehicle, okay, aqueous vehicle or non-aqueous vehicle. We take and additives like preservatives, antibiotics, humectants, all these things we need. And now the active ingredient basically in ear preparations are antibiotic, antifungal, anti-inflammatory, antiseptic, cleansing solution and wax softener. So these are the basic therapeutic ingredient having these categories which are used for formulation of ear drop. Now what are the drugs we use for the formulation topically in the ear for anti-infective activity? So anti-infective activity, such ingredient like ciprofloxacin, colistin sulfate, neomycin, ofloxacin, polymyxin B sulfate, nystatin. So these agents are used as anti-infective activity. So these agents are formulated into the ear drop, whether in the form of a solution or in suspension or in a vehicle of anhydrous glycerin or propylene glycol. So the use of these viscous vehicle permits, as I also told you in the previous slide, that it is going to permit the more retention of ear drop, okay, because of its higher viscosity. Now to assist in relieving the pain that is frequently due to infections, ear infection, so along with the anti-infective agents, some of analgesic agents are also included, such as antipyrine, and some local anesthetics such as paramoxine hydrochloride and benzocaine are also used. And topical treatment of infection is frequently considered adjunctive with concomitant systematic treatment with orally administered antibiotics. Now liquid ear preparation containing anti-inflammatory agents, hydrocortisone, dexamethasone sodium are prescribed for allergic and irritative manifestations of ear. So apart from the antibiotic and steroid combinations that are used to treat the otitis externa and swimmers to protect the swimmer's ear, acetic acid 2% in aluminum acetate solution and boric acid 2.75% in IPA are used. Now, the source of acetic acid. What is the source of acetic acid? It can be glacier acetic acid, USP, or acetic acid, NF, boric acid 2% to 5% dissolved either in ethanol or in propenyl glycol is recommended. Now, the topical analgesics agents generally are employed together with internally administered analgesics such as aspirin and other agents. Most topical analgesics for ear solutions, and it may contain analgesic, antipyrine and local anesthetics are benzocaine in a vehicle of propylene glycol or anhydrous glycerin. Now these hygroscopic vehicle, they reduce the swelling of the tissue and growth of microorganism by drawing the moisture from the swollen tissue into the vehicle. Now preservation is also needed to protect the eardrop from microbial contamination. So when preservative is required, the chlorobutanol 0.5%, okay, thimerosal 0.01%, and the combination of both can be, and the various combinations of parabens are commonly used. Antioxidants such as sodium bisulfide and other stabilizers are included in otic formulations. Now moving to the role of dispensing pharmacy. See, before administration, there are certain instructions to be given by the dispensing pharmacist. Alright, that how it has to be used. So when eardrop is prescribed, it is very important for the pharmacist to determine how it is to be used and to explain it to the patient. For example, earwax removal drop should be instilled when removed with an ear syringe. Okay, eardrop intended to treat external otitis infections are intended to be instilled and left in the ear. Now, pharmacists should make sure that the child, parent, or the caretaker understands that the administration is intended for the ear and in which frequency it has to be administered. So if the product is in the form of suspension, so it has to be shaken before withdrawal from the drops from the container, and pharmacist should also explain the need of the storage condition for the product. So all these things should be explained by the dispensing pharmacist. Now, in continuation to the proper use and administration of eardrop, the eardrop, when it is instilled into the eye, to allow the drop to run in deeper, the earlobe should be held up and back, and for a child the earlobe should be held gently down and back. For convenience, it is probably easier to have someone other than patient to administer the drop, and patient and the children should be warned about the drops that causes stinging upon administration. The patient should also know that how long it has to be used. For antibiotic, it is not necessary to finish the entire bottle because of the therapy could last to 20 to 30 days depending on the doses regimen. So it is very important to keep it in mind about the doses regimen, and accordingly it has to be administered. If a child is prone to develop ear infection as a result of swimming and showering, so it might be advisable to recommend to the parent to consult a physician for prophylactic medication to be used during swimming season, and consider using ear plug that fit snugly into the ear when swimming or showering. So these are some instructions which has to be followed. The auditory canal should be cleaned thoroughly before installations. Now here are few instructions about installation of ear drop. The auditory canal should be cleaned thoroughly, and to avoid the vertigo, the eardrop should be warmed by placing the container in a bowl of warm water, and place the patient in the side lying position and ask him to lift the head to the side with the ear to be treated facing up. Okay, so this way it is going to be administered in a easy way. Now with the cleaning the ear thoroughly to make installation and medication, it is also important that to administer the eardrop drop by drop on the side wall of auditory canal, which allows air to escape from auditory canal. The dropper should be held at least 1 to 2 centimeter above the ear canal, which prevents the accidental contact of dropper with delicate structures. It allows complete distribution of medication to the patient, and should remain in the same, and the patient should remain in the same position for few minutes. Next is prevention of medication from coming out of the ear. A cotton plug or a cotton gauge, it should be used. Okay, to prevent the cross infection, hand should be washed properly. Okay, to avoid any kind of contamination by the hand of patient or the nurse or pharmacist who is administering the eardrop into the ear of the patient, the proper hand hygiene should be maintained. Now take an example of a preparation like sodium bicarbonate eardrop. See, look at the ingredients: sodium bicarbonate, glycerin and purified water up to the required volume. Okay, now prepare a eardrop, and if say example the direction is 2 to 3 drops in ear as directed. So it was the formula. Now cerumen removing solution. Now what is cerumen? I told you earlier that cerumen is a ear wax, and it is a combination of secretions of sweat and sebaceous gland of external auditory canal. This secretion, after drying, it forms a sticky semi-solid that traps the fallen hair, dust and other foreign bodies that makes way to the ear canal. And excessive accumulation of cerumen in the ear, it may cause itching, pain, little bit pain and impaired hearing sometimes, and so it requires the otologic examination. Okay, if it is not removed periodically, the cerumen may become impacted and its removal may be more difficult and painful. So common agents which are used for removal of cerumen, it includes light mineral oil, vegetable oils, hydrogen peroxide, and recently solutions of synthetic surfactant have been developed for their ability to remove the ear wax. Okay, one commercial product like glycol, okay, Dabrox drops, murine ear. So these are used. One more thing, that cerumen removal usually involves placing the otic solution in the ear canal with the patient's head tilted at 45 degrees. Inserting a cotton plug to retain the medication in the ear for 15 to 30 minutes, followed by gentle flushing of the ear canal with lukewarm water using a soft rubber ear syringe. Okay, so it is cerumen removing solution, and if it causes more difficulty to the patient in terms of itching, pain, and some sort of discomfort, so the patient has to consult with the physician for this, and the required measures should be done in terms of a eye drop or the solutions which helps in the removal of cerumen from the ear. Okay. Okay, next moving to the eye drop. Eye drop, it is eye drop. It is, so it has to be instilled into the eye in the space between eyelid and eyeball. Okay, and sterile product, these ophthalmic products are sterile products. Eye drop is the major method of administration for the topical ocular route. Okay, so it is the most important formulation to be administered through eye. So these are one of the few doses form which is not given by exact volume or weight, but just it is as recommended by the ophthalmist. It has to be administered, and the volume depends on the physicochemical properties of the formulation, such as surface tension, design, geometry of the dispensing orifice, and angle at which the dispenser is held. Now, what are the essential characteristics of an eye drop? What are the essential characteristics? It should be simple, easy, and it should need less administrative frequency, and should have good permeation in cornea, should minimize the precorneal drug loss and maximize ocular drug absorption, should not cause irritation, blurring of vision. Okay, should have no side effect and toxicity, should be non-greasy, and should be patient friendly. Now, what are the excipients? Excipients used in eye drop: thickening agent, methyl cellulose, and propyl vinyl alcohol, propylene glycol are the agent used for increasing the viscosity of the eye drop. Okay, and increased viscosity, it results in the increased residence time of the drop, and so that the permeation is increased along with the therapeutic effect, and finally the bioavailability of the product is going to increase. So this is the role of thickening agent in the formulation of eye drop. Okay, so next is buffers. Buffers are added to maintain the pH of the eye drop along with the comfort, because if the pH is not suitable and if it is not optimum, then it is going to cause irritation, some sort of itching, and discomfort to the eye. So boric acid, sodium acid phosphate, and sodium citrate buffers are used to maintain the pH. Third is antioxidants. So these are added to prevent the oxidation and discoloration of sodium, discoloration of eye drop. So example, if we take sodium metabisulfate from the in the concentration range 0.5 to 5%, and sodium thiosulfate in concentration 0.1 to 0.2%. Okay, all right. You can also refer additional other examples of antioxidant with their specific concentrations they are used. Okay, wetting agent. Okay, these are the agents which are going to facilitate the proper penetration of eye drop into the cornea. Polysorbate 20, polysorbate 80. These are few examples. So dear students, I suggest you to go through from other examples of wetting agent and antioxidants and remember them so that it will be easier for you to write in the examination. Next is antimicrobial preservatives. So they are included as a major component of all multiple dose eye solution. Why it is needed? Because multiple dose, we are not going to use the entire content at once. So preservation is important for them. You can see the example: benzalkonium chloride, phenyl mercuric nitrate, phenyl mercuric acetate, okay, and methyl paraben. These are few examples, and their concentration, you just see the concentration in the slide and go through from it and remember it that these are the antimicrobial preservatives. Next is isotonicity modifier. This is also important along with the sterility. See, sterility and isotonicity, these are two important characteristics an ophthalmic eye drop should have. Sterility as well as isotonicity. Isotonicity, ear drop has to maintain the osmotic pressure with lacrimal fluid to avoid any kind of pain and irritation or discomfort. So these are added after all the additives have been added, so that each ingredient contribute towards its overall osmotic pressure of the solution. So 0.5 to 2% sodium chloride solution are added. So you can also refer the other isotonicity adjusting agent for eye drop. Next is chillating agent. Now chillating agent, heavy metals, catalyzes the breakdown of the active ingredient by oxidation. So these agents are added to chillate metal ions and enhance the antibacterial activity and overall chemical stability of the product. Now next is the bioavailability. Now bioavailability, the dissociated drug that reaches to the stroma and the endothelium, and it will again partially associate, forming the lipid soluble moiety, and thus it crosses the endothelial barrier. Okay, so when the drug dissociate into its water soluble form and enter the aqueous humor, from here it diffuses to the iris and the ciliary body where the pharmacological action occurs. Alright, so this is about eye drops bioavailability, that how it is going to be available to the systemic circulation in the actual quantity. Now formulation, quickly moving to the formulation, preparation of the solution, vehicle containing preservative, antioxidant, stabilizer, tonicity modifier and buffer is made, active ingredient is added and the vehicle is made up to the required volume. And for preventing the bacterial and the fungal growth, one of the following bactericidal is added, like benzalkonium chloride and chlorhexidine acetate in the required concentration. Second is clarification. The effort should be made to make a clear solution, clear transparent solution. There should not be anything present in the solution, and no particulate matter should be present, and sintered glass filter and membrane filters are used for this, for clarification of solution. And third important step is sterilization. I am again and again mentioning that for ophthalmic product, sterility is must. So autoclaving, okay. So dear student, also remember the standard temperature of autoclaving, what it is, because it may be asked in multiple choice question in the examination. So 115 degrees centigrade for 30 minutes or 121 degrees centigrade for 15 minutes. Alright. Heating 98 to 100 degrees centigrade for 30 minutes with benzalkonium chloride, and filtration, dry heat sterilizations. All these methods are adopted for sterilization. Next is the final filling and labeling of the formulation. Just take example, atropine sulfate eye drop. It contains atropine sulfate, phenyl mercuric nitrate and solution purified water. Now instructions for using eye drop, remove the cap from the container, place it to the clean place, and the eye drop is present, then fill it by squeezing the bulb, and dropper should not be turned upside down and prevent backflow of medicine to bulb end, and using fingers pull the lower eyelid gently and expose the inner surface of lid from the pouch. Then patient is instructed to look upward, and then it is dropped into the center of lower lid. Okay. Now open the eye and excessive solution is wiped after a few minutes. So these are instructions. And wash the hand after instilling the medication to the patient to prevent any kind of cross contamination or cross infection. And if additional eye drop is required, then wait for 5 minutes between each installation so that the proper absorption of medication takes place. So that's all, dear students. This is about the instruction for using eye drop, and these are the references. Just go through from the references for more and better understanding of this topic. So dear students, now quickly summarizing this topic. Today in this module we discussed about ear drop and eye drops. Okay, these are pharmaceutical preparations. Eye drop is instilled into the eye cavity in the space between eyelid and eyeball, and ear drop is instilled into the ear. Okay. And what all we discussed? Ingredients. What are the ingredients used in the formulation of both eye drops and ear drops, and instructions required for dispensing pharmacist and for the patients, how to handle these two preparations, and all additional aspects related to eye drop and ear drops. So dear students, I really hope that you have enjoyed this module. So that's all for this module, and stay tuned for more videos, and thank you so much for watching this video.